Eczema is done. What do we move on to next? We move on to the next part, and that is going to be Borrelia. And I already told you Borrelia, look at the spirals out here. Borrelia is going to have very, very loose spirals, and because it has Lu, you had to do which kind of motility is it going to have? It's going to have the lashing motility. Fine, but what are the different Borrelias? We have Borrelia burgdorferi, we have recurrentis, and we have vincenti. So no points for guessing that Vincent's angina is going to be caused by Borrelia vincenti. Recurrentis will cause something which is recurring, happening again and again. So that is going to be relapsing fever. And Borrelia burgdorferi causes what is left, and that is Lyme's disease. It is going to be Lyme's disease. Lyme's disease is important in India also, but USA, if you're planning to give any USMLE foreign exams, trust me, Lyme's disease question, I can vouch for it, will definitely come. So let's start one by one. Borrelia burgdorferi, Lyme's disease. As I was telling you, it's USA MENA. So this is the Lyme's disease caused by burgdorferi, is the most common vector-borne disease in United States of America. So you will ask me which vector. We are talking about the bite of which vector? It happens by the bite of the heart tick. So remember, the ixoid tick, the heart tick, is going to result in this particular condition. And what is the incubation period? It's somewhere between, you can say, less than 1 week to 1 month. So 3 to 30 days you can learn. I hope you remember, before this we did syphilis. Syphilis had an interesting incubation period of 90 to 90 days. Now I'm talking about Lyme disease. Lyme disease has an incubation period of 3 to 30 days, and it happens by the bite of an ixoid hard tick. So how is it that the patient is going to present? Imagine there's a tick which has come and bitten. Will that area become very, very red? So first I'll start with rash. Then I'll go to different organs of the body like the brain and the heart and all of that. So please remember, the first stage will be localized infection. Then I will talk about different organs of the body, and after that, maybe the infection ended up staying even longer. Then what will happen? So you've understood the chronology. First, you'll talk about the localized infection. So like I told you, this is the area where the tick bites. At the site of a tick bite, there is this word, guys. I wish I could enlarge it, zoom in and show it to you. Remember, I'm doing that multiple times because this is like to give you that Hindi serials wala, Hindi serial TV soap wala 3-time effect I want to give you, because this is so damn important. Please remember that wherever the tick bites, there's a bullseye lesion. Bullseye lesion means target rash, or bullseye, or something like a ring. Means what? Firstly, what do you call it? You call it ECM. Erythema chronicum migrans. What all does that mean? Erythema. Erythema means reddish color. Erythema basically means that there is a reddish color that is going to be produced. But why did I say chronicum? Because it goes on for a long time. And why do you say migrans? Migrans is because it will keep on going redder on the outside. It will gradually, the redness will keep on going on the outside, and as it will go outside, what will happen in the center? The center will dhire start becoming clear, like over here, then over here, then over here. So simple as that. As the redness is spreading, migrating outside, it's gonna become clear in the center. So simple, guys. I hope you've understood. Not only that, that is your primary, where the tick was biting, erythema chronicum migrans. After some time, you will see chota lesions in the periphery, similar small lesions called satellite lesions around it. Other than erythema chronicum migrans, chota lesions will be seen around it. And disseminated means it's going to other organs. It is going to the cardiovascular, the CNS, as well as the joints. So when I say cardiovascular, please remember, it can cause AV block, it can cause myocarditis. When I talk about CNS, write it in bold letters. Another 3-time impact that I want to tell you. Facial nerve palsy. And finally, for joints, I've told you, joints are involved usually in the 3rd stage, where patient ends up having Lyme's arthritis. So simple. First, there is a localized infection where there is erythema chronicum migrans. Dhire that will keep on spreading. It will become disseminated with chota lesions with cardiac and CNS involvement. Facial nerve palsy, put it in your mind, because you will always get a history of there would be a tick bite, and following a tick bite, there is a reddish color, erythema chronicum migrans, and patient has had facial nerve palsy. It's a classical Lyme's disease. And in the end, there is going to be Lyme's arthritis. This is it? No, this is not the only CNS problem. In post or further in the disease, there can be one more disease that happens as a complication of Borrelia burgdorferi, can show you what we call as meningeal involvement. it can show you meningeal involvement, and meningeal involvement basically means that there is gonna be brain involvement, है ना? तो simple. Banworth syndrome is what you call it. Borrelia burgdorferi causes Banworth syndrome, which is nothing but the involvement of the brain, and that is going to result in painful radiculoneuritis. Painful radiculoneuritis. You will ask me, what is painful radiculoneuritis? So that is going to result in pain and burning. So another B, there's B for burning. There is pain and burning, and radiculoneuritis means in certain radicals, means along dermatomes. Along dermatomes. So there is going to be dermatomal distribution that you notice. Just for your understanding, I'm telling you, you don't need to know in so much of detail. You just need to know Borrelia burgdorferi causes Banworth syndrome, which is a brain involvement in which there is going to be a burning sensation that we are going to have along dermatome. So now coming to the lab diagnosis of sample will depend on your organ, na? Which organ, or has it been the blood involvement or the nerve involvement or the CSF? So that depends on the sample. Okay, you can also do a biopsy. Again, if arthritis hua hai, so you can take a synovial tissue. If the erythema chronicum migrans is there, you can take a skin biopsy. What is the stain? WSSS. What is WSSS? Warthin starry silver stain can be used. Apart from that, you can use some kind of PCR also. Real-time PCR can also be used. You can do a serology, and serology means you're always going to do an ELISA in this case. Sorted. So there's nothing fancy that I told you, honestly telling you. Matlab usual hai. For everything you do PCR, for everything you do ELISA. Only thing for Borrelia burgdorferi you had to learn was Warthin starry silver stain. Coming to the treatment is ceftriaxone. That is also something you've read earlier. Borrelia burgdorferi is done. Now I'm left with the next one, Borrelia recurrentis. Something is going to come again and again. That means there is relapsing fever and relapsing fever. So that's not just Borrelia recurrentis. Remember, there is something called Borrelia recurrentis and there is something called Borrelia duttonii. One of them is louse bone, that is epidemic. One of them is tick bone, that is going to be endemic. So how do I learn so much of this information? Please note that when I'm talking about the recurrentis, this you've understood, it causes relapsing fever, but it causes louse wala relapsing fever. But duttonii has a lot of T's. So that I can learn that duttonii is going to cause the tick wala relapsing fever. Okay, so now how do I learn which is epidemic and which is endemic? So I'm going to say that louse reminds you of love, and you have to spread love all over, not just in endemic, not just in your locality. You have to spread love everywhere. So you have to spread love everywhere. This means love, of course, in today's date, thanks to all the dating apps that we have, love also happens again and again. Recurrentis, okay? It happens on every left and right swipe. So remember, you're going to spread the love again and again. So spread the love again and again means that you're talking about spread means all over, epidemic, love means louse, and everywhere, and again and again means it is going to be relapsing fever. That is the story of Borrelia recurrentis. But whom are you spreading love between? Of course, if they ask you between human to human or between human to animal. So now this kind of online dating love is of course happening between human to human. So this is going to happen between human to human, and this is louse related. So now the next question is the louse going to just abrade or just rub over the skin, or is it going to bite? So remember, this is the story of a lazy louse. See, any of you who've been in a relationship or are currently in a relationship, you know that once you enter in a relationship, you tend to become just very lazy. So this louse has also become very lazy. This is a lazy louse. It is not going to bite. It is not going to bite. It is just going to go and get crushed on the skin. So it's a lazy louse. Whereas when I talk about now the other one, see, if that was epidemic, other one is endemic. If the epidemic was louse bone, endemic is tick bone, and that is caused by duttonii. If epidemic was between human to human and the louse was getting crushed, now the next one is going to be between animals and tick. The other one is going to be between this tick and animals, right? And that is going to happen because of a tick bite. Over there, there's no lazy louse happening. So remember, jo tick wala hai, wo bite se hota hai. Jo louse wala hai, that is a lazy louse. So learn any one story. Nice story I've told you about a relationship. That is, this is a person who's fallen in love and he's spreading love all over the world, epidemic louse, and he's having love again and again. So recurrentis is the organism, and this love is between human to human, and that person has become lazy. It's a lazy louse which is just going to get crushed. Now let's move forward. What is the pathogenicity? that we have to know. So my first word is, it is a relapsing fever. All that I'm going to say is fever is going to come, fever is going to go, then come again, then go again. So remember, the incubation period is roughly 2 to 10 days. Fever lasts for 3 to 5 days. This is the duration in which the fever lasts. Until the time the fever will last, you are gonna see abundant organisms in the blood. So you will say that, okay, fever hai, so organisms are there in the blood sample. After that, the patient is gonna go absconding, no fever for 4 to 10 days. This means the blood is now not gonna show you any organism. So simple, how I have learned it is, if fever is present, organism is present. If fever goes absent, the organism goes absent. So when do you think you're going to take blood sample from this patient? When he has the fever, of course, that is when I call him for a blood sample. So he's going to be afebrile for 4 to 10 days, and then again he's going to relapse back. Again he's going to have fever, and then again the blood organism will come back. So fever hoga, nahi hoga. This is exactly how love these days is. That is, I was telling you the story of online dating apps. You are having a love connection for a few days, and then someone goes absconding, right? Someone ghosting, that's a new term, right? That is what they say, the person has gone ghosting. So same over here, love is happening for a few days, and then after that there is ghosting happening, then again love is happening for a few days, then again ghosting happening. Simple. So fever, then no fever, fever, then no fever. Fever hai, organism hai, fever nahi hai, organism nahi hai. Now remember, if I have to take the sample, tell me, when do you take the blood sample? During the fever, during the pyrexia phase. And which microscopy will you use? I've already told you these are very, very thin organisms. We always use dark field microscope, and we can either use the silver stains, we can also use the Jimsa and Leishman. You'll say, ma'am, right now you told me these are all silver stain wala organisms, but Borrelia is something that you can use Leishman and Jimsa also. Culture, there are no cultures over here, and for serology everywhere I use ELISA, wo copy paste karna hai. What is the treatment, guys? We are gonna give tetracyclines and chloramphenicol, and there is no vaccination available for this Borrelia that we have. No vaccination for relapsing fever. What are we left with? Borrelia Vincenti. What is it going to cause? Of course, it is going to cause Vincent's angina, and this is also something which is normally present in the mouth. So whatever is going to cause in the mouth only, na? It is an ulcerogingivostomatitis. That's how it's a kind of a tongue twister. It's an ulcerogingivostomatitis. So something in the mouth, because it is normally also present in the mouth. The same microscopy copy paste, dark field microscope, the same PCR, the same ELISA, everything goes the same, nothing new. Treatment is going to be penicillin and metronidazole. Now I want to ask you, does Borrelia vincenti have a symbiotic relationship with someone? Does Borrelia vincenti that is a spirochete, have a symbiotic relationship with Fusobacterium? Yes. So what do you call it? See, Borrelia vincenti is a spirochete, and Fusobacterium ka Fusolia, so together they are known as Fusospiroketosis. That tends to occur as a symbiotic relationship. So there's no, at the max, Fuso ke saath to everyone will know Fusobacterium. They can just ask you which spirochete. So you need to know it is Borrelia vincenti. So where are we, guys? Treponema done, Borrelia done. Now the Lepetava story. This means Leptospira. And how have I written? Leptospira I have written. I'll tell you why I wrote it like that. Leptospira RRRR. Firstly, what does it cause? So remember, I'm going to add one more over here, R over here, because I think I'll be needing many more R's in this story. That is I have learned it, Leptospira, that is rotating wheel jaisa. I'm saying Leptospira, ra, ra. So remember, Weil's disease is what it causes. Weil's disease, sab kuch, if you remember, everything in it was Lepetava. Do you remember how the Leptospira was going to look like? I've already shown you. I'll show you once again. Remember, it was the organism that had hooked ends. Yes, it's Lepetava. So same way, it's going to have a Weil's disease. And what is Weil's disease? The full form is very important. It is known as icterohemorrhagic fever. That is what is the real name, in fact. Icterohemorrhagic fever means there is going to be jaundice, there is going to be bleeding, and there is going to be fever. And why is that happening? It is also known as one more thing. So one is icterohemorrhagic fever, one is known as hepatorenal syndrome. So if they ask you which are the two organs most commonly involved, it is liver and kidney, hepatorenal syndrome. What is the classification, guys? There are many Leptospira. I just want you to learn the pathogenic one, that is interrogans. Another RRR coming your way, na? So it is going to be interrogans. So first and foremost, I have learned Leptospira, kaun sa, interrogans wala. Now 3 more R's I'm going to take out of it, because now I will tell you that this happens to be a zoonotic disease, something to do with, no, R for, there's going to be a rat. Okay, there's going to be a rat in the story. Then R for, there is going to be rainy water. So there's going to be clouds and there's going to be rainy water in the story. And the next R is going to be the rice field. So you're going to see some nice rice fields also in the story. Okay, so if you see that they are saying that there is rat urine which is going to contaminate the rainy water, and rainy water is for which fields? It's for the rice or the paddy field workers. So what did I say? If rat urine contaminates rainy water, and that is basically the rice paddy field workers are walking on that, so they will get infected. Of course, they are going to get infected. So basically, kya hai? There's no bite happening. So you will very clearly see over here, there is no bite happening at all. This is just a contamination of rat urine in rainy water, and the paddy field workers are walking over it. I hope everyone's okay with this, because now I am able to tell you what is this illness. Very important. Suddenly you will be like, you want to run away. So much of information written. Trust me, it's very simple. There's a first stage where there's more of septicemia, main disease. Second stage is when there will be starting of immunity development, antibodies aa jayenge, theek hai? So first stage is going to last for 10 days, second stage will last up till 30 days, theek hai? 10 days, 30 days. Now tell me, if you're saying ictero, I'll pick up jaundice. Then you're saying, and also, why am I saying ictero? So jaundice. So you'll say jaundice matlab kaun sa organ, ma'am? You are also calling it hepatorenal syndrome. So everything to do with hepato. There will be raised liver enzymes that you're going to notice. Okay, so ictero and liver is done. Hemorrhagic. Hemorrhagic means that these patients are going to have so many hemorrhages on the conjunctiva, the skin, the pulmonary. And I called it hepatorenal syndrome. So there is definitely involvement of renal. Renal matlab raised creatinine. Hepatorenal syndrome, ictero, hemorrhagic fever. So of course there is high grade fever. Did you have to learn even one thing? And the same copy pasted in the next one, but little less severe. So repeating, ictero means jaundice, hemorrhage means hemorrhage, fever of course fever, hepato means liver enzymes are raised, renal means creatinine is raised. That is the Weil's disease or the diseases that I've told you. So in the first stage, when it is septicemic, you will find the blood and the CSF, everything showing you the organism or showing you the sample to be collected, but for later stage you will take the urine from the patient. And which of them will show you IgM? Ma'am, the immune phase is the second one. That is when you will start seeing the presence of serology. What is the treatment? In the first part or the first stage, it is going to be doxycycline, and the second stage is rather refractory, and that is when you have to go in for penicillin. Okay, so if I have to show you the organism as a lab diagnosis under the microscope, I think you know the microscopy that you will be using, dark field microscopy, and you know that it is the one that is going to have hooked ends, and that is what I taught you now. It is Lapeta Hua spiral. Lapeta Hua spiral. So if I go all the way back, I told you it is lepto spy, and I used 5 R's in it. So firstly, R I have said it is going to be what? Interrogans, Leptospira interrogans. Then I've used the 3 R's in rat, rainy water and rice water fields. There is 1 R still left, because now I'll tell you it tends to make, firstly, there are 3 scientists wale media. Okay, EMJH media, then you have the Korthoff media and the Fletcher media. But this one, EMJH media, shows you the presence of R for ring. There is something known as Dinger's ring. Can you all see? There are 2 tubes. This is one, you can see the level of the media. But can you see in one of them there is a ring below that? Yes, that is known as the Dinger's ring that you see in EMJH media. So finally your last R is also done. It shows you the Dinger's ring. Right? In serology, very interesting. Serology shows you possibility of microscopic agglutination test. I have taught you all the agglutination tests. There is standard agglutination, cold agglutination, microscopic agglutination, right? I am going to teach you this one more time. What all have I taught you? I have already taught you the standard agglutination test that I had taught you for brucellosis, brucella in the last chapter. Now I am teaching you microscopic agglutination test, and that is going to be for Leptospira. The next and the last chapter that I will teach you will be cold agglutination test, which will be for mycoplasma. And you remember that mnemonic? Cat sat on a mat. Cat sat on a mat matlab? That I've learned. Cat sat on a mat. But we had learned my. So my for mycoplasma, my billy. my billi. So that means Mycoplasma, Brucella and Leptospira. So cat sat on a mat, my billi. I will be repeating this mnemonic once again when we are left with Mycoplasma, right? So microscopic agglutination test for Leptospira. Just for your knowledge, you should know that Port Blair has the National Reference Center for Leptospira. So that is also done. Also, one more thing in epidemiology will really be helpful to you guys. For the lab diagnosis, we also have something called the Fiennes criteria or Fiennes criteria is how they say it. So that takes, I don't want you to do the 25 ka total aayega, so what is it, 26 ka total aayega, that I don't want you to know. I just want you to know that this takes into account epidemiology. That is why I'm saying you will use it in PSM medicine. It takes into account clinical and micro. So basically micro, medicine and PSM ka combination. The clinical data of the patient, the epidemiology data and the lab diagnosis with IgM, that is what is taken into account. And just you should know this fancy name that Fiennes criteria is for Leptospira. We are done with the spirochete family. And guys, you are ready for some questions. Which of the following statements about the diagnostic modalities of Treponema pallidum is incorrect? Let's start reading. Let's do a true and false. Is VDRL is positive in secondary syphilis? Of course, VDRL can be positive. Okay, RPR is used as a diagnostic modality in CSF samples. No, if you're talking about neurosyphilis, I told you neuro is a very, very complicated version. You need the complicated test and that is VDRL. So this is the false statement. Third, antigen used for VDRL is killed Treponema pallidum. No, we had done something called cardiolipin, isn't it? So this is also false. I realize 2 and 3 are false. I have that as an option. So that becomes my answer. Let's quickly pick up one more question over here. Identify the stain used for the diagnosis of the lymph node of a patient with suspected syphilis. Guys, syphilis, what all do we have? Warthin-Starry stain, no. Giemsa, no. Gomori methenamine silver, no. But I know that we have two stains which we use. We use the Fontana stain and we use the Levadity stain. These are the two silver stains that we are using. Of course, this is what we can. I have Levadity in the options over here. So yes, on that note, we have wrapped up our discussion of the spirochetes. We are now continuing with that MRCS mnemonic of ours, and we are going to go ahead and talk about the next family, that is